Hi, I'm Ross Gilfillan. Welcome to Global Franchise Meets. In this series, we talk to the leaders and the experts of international franchising. Today, we meet Shelly Sun of BrightStar Care.
I'm Shelly Sun. I'm the CEO and founder of BrightStar Care. We're a franchisor in the US and Canada with over 300 locations. I also am currently the chairwoman of the International Franchising Association. Well, I started my company-owned locations in the senior care sector in 2002, and then had an opportunity to invest in 2 hotels in 2004. And actually went to new manager and new owner training in 2004 and saw franchising as a great way to grow and expand my senior care business that was just in Illinois at that point in time. So launched our franchise model in late 2005, early 2006. And almost all of our growth over the last 15 years has come through franchising. We have 1 company-owned location and 314 franchise locations, plus our master franchisee in Canada. Yeah, I'd see franchising as a great way to have standardization and investments in technology and marketing that a small mom and pop could never do on their own. But it allows us to have a consistent brand, but the passion and the capital investment at the local level to make sure that the consumer is receiving the best possible care. In our business, we're taking care of grandmas and grandpas, moms and dads and children. So we want to make sure the care delivery is absolutely at the highest level. And so for us, it's about a national consistency and technology investment, and then local execution and customer interaction. I think master franchising is a great way to learn an industry that someone might not be familiar with, get lots of techniques and training and marketing resources for a brand that's been very successful. I mean, clearly, there's a lot involved in researching what are the brands that a master franchisee might want to become involved in, and making sure that there is a built-in customer base. In our case, the demographics are really aligned around healthcare. Certainly, there's a lot of changes happening in the UK with underfunding of government and more things through means testing, making sure forcing the consumer to have to pay for it. So I think those are all headed in the right direction, that having someone be a part of that solution as a master franchisee, I think the opportunity is great, but they want to make sure that they are looking at their franchisor as someone who has successfully done it, and has points of differentiation that can't be easily duplicated. So for us, very large investments in technology, in accreditation and outcomes based upon helping people live better lives, and actually being able to document that, and a real successful strategy and being able to reach the consumer so that they're educated about home care services and help them make a decision about selecting those services. Those are all 3 points of differentiation that are going to be important for a master to be successful in bringing home care delivery to the UK marketplace. I think really assessing their own skills and their infrastructure that they're willing to invest in. For me, I think the business model needs to be sound. I think that's going to create a great opportunity for a master franchisee to be successful. But I think there also is a fit on a master franchisee, whether they have in mind the number of years it's going to take to build scale and infrastructure to become, and in some ways, as a master franchisee, their own mini franchisor. Some franchisees are the size of the franchisor. And so I think looking at that is not a short-term investment, but a long-term investment. Looking at their own skill set and being able to build out teams and hold people accountable. I would say that in our industry, it's really important that a master franchisee is not just looking at the demographics, but has also had a personal experience with care. So they're passionate about making a difference in their community, passionate about delivering these type of services, because with that passion, they'll find the solutions to bring more of these services to more consumers and do it in a way that consumers can also afford and be able to access. I think obstacles are usually around capital, because I think you have to be able to invest to reach scale. I think it's also about making sure that you're willing to set aside maybe what you knew and just become a student for a while, learning sometimes a brand new industry, learning franchising sometimes for the first time. We typically try to look for someone who has either healthcare or franchising experience. Somewhat difficult to learn both, to be a first-time master franchisee and be a first-time healthcare individual. So we're looking for one of those two. I think that some of the obstacles is not understanding how much work and how much capital it's going to take. I think there's ways to network with other master franchisees that have been down this path. At some point, every master franchisee or first-time master franchisee, and for me, as I was a brand new franchisor, I tried to learn what was going to be hard and what was going to be easy from other franchisors that had started up. And I think that really helped me have realistic expectations about what the road ahead would look like. I think that's true for a master franchisee as well. I think researching what I think is going to come across two levels. One, in the services that are going to be provided, whether that's food service or healthcare or retail. Is there a customer demand, and then what are the demographics and purchasing decisions that are influencing that? And then research around the franchisor and their reputation and their success. Either within country, if it's a UK-based franchisor that's looking for franchisees, or looking at US-based franchisors that are looking at bringing a footprint into the UK. I think it's about looking at their success domestically as it relates to the United States. I think it's also about looking at what kind of investments and what kind of philosophy they have on international expansion. For me, I own 100% of my company. I have no need to have to go international. So for me, it's about really wanting to make an impact on consumers around the world, be a part of how healthcare is going to evolve around the world. And for us, it's not about just planting a flag and coming back and hoping that it works. It's about really trying to partner and make sure we're successful for the long term. For us, we look at an international investment being, 5 years before we will recover, and we're looking for a master franchisee that kind of has a similar philosophy. This is not about, doing it quick and just selling sub-franchises that may or may not be successful. It's about taking a long-term approach to make sure the brand is successful. If we do that right, and we are passionate about doing that as a franchisor, the master franchisee is passionate about doing that themselves, there will be a long-term financial reward for both parties, but we both have to be equally committed in what we're going to do and how we're going to support each other. I think there are a lot of resources. The International Franchise Association is a resource. Pip, that is the CEO at the British Franchise Association, is amazing. So I'm sure she has an ability to take a first-timer and introduce them to other master franchisees. I had an opportunity to meet with the British Franchise Association on my recent visit to the UK, and everybody was very welcoming and kind of understood our philosophy of really wanting to be a strong part of the fabric of the franchise and healthcare community, and invest in that and be able to share information as well as hopefully learn information as well. I think if they know already that home care services, healthcare services is something that they are interested in, I think contacting our headquarters is one where we have a path to walk them through the journey of kind of investigating that opportunity. If it's someone who hasn't yet decided what they might want to do, there are brokers that can help them kind of self-investigate what different industries they might be great at, what, based on the capital they have to deploy, what might be the right matches in terms of investment range that franchisors are seeking in a master with the funds that a master franchisee might have. So it depends kind of how ready they are and how much they understand about what they want to do in terms of a sector. I think I would really try to learn from those that have been successful and what have been the areas of mistakes that they've made. What were the things that went well? What were some of those critical key hires? If it went great, what might an investment range look like? If it didn't go great and it took longer, that is going to happen across the sectors to different master franchisees. I think having a feel for that, because as a franchisor, we're not going to be able to help with a lot of that financial information. We can show what's been done in the U.S., but being a master is completely different. So I think being able to rely on other masters as to how fast do things ramp in the service industry, what might the capital requirements look like, how much am I needing to invest in my own infrastructure, is that technology, is that marketing, or is that field support operations, and then how many company-owned locations do I need to have to learn the business model, show the business model works locally before I begin to expand out, and then how quickly can I expand? And that's usually a function of infrastructure and supporting those sub-franchisees that are coming on board. I think there's a lot to be said for learning from those that have kind of trailed, have gone down that path before. And I think that's where I would be starting if I was someone who was looking to become a master franchisee. Yeah, I think the public generally sees franchising, even, in the States as McDonald's. And I think what they've gotten wrong is that franchising touches every fabric of the economy. Services, there's, so many companies, whether it's maid services or home care services, child care, tutoring services. I mean, almost everything that you can think of, the hotels that you stay in, many of the restaurants that you eat at, franchising touches so many things and therefore creates so many jobs. It's an important thing from a customer perspective because it allows you to know that if you're going to go into one McDonald's in one country and a McDonald's in a different country, you're going to get a very similar experience. French fries are always going to taste great. The bathrooms are generally always going to be clean. Hotels, very similar. And, for healthcare and taking care of seniors, we're going to want to operate at that highest standard that we're making sure that franchisees are doing the right things and held to a standard. Those are moms and dads, grandmas and grandpas we're taking care of. So I think franchising is important in terms of consumer safety and experience. But I don't think the public at large realizes how far franchising penetrates into every sector. And those are locally owned and operated. Everybody says we want to buy from mom and pops. We want to buy local. Well, franchises are local too. Those are franchisees that have invested the same money to become a franchisee as a mom and pop that put up their own shingle, invested to start their business. I think the franchising model really allows the ability to achieve scale, and scale allows consistency. It allows investment in things that I think are great for the consumer, great for the workforce in terms of investments in technology. It allows more consumers to know about the brand as you kind of scale it across a franchise system. Difficult to maybe make a certain community aware of XYZ home care versus being aware of BrightStar Care because it was featured on Undercover Boss. That power and scale of franchising is something that I think is difficult to achieve without being part of a fabric of franchising that touches so many different people and reaches so much exposure. I think we have seen over the last 2 to 3 years, we've had a change in the administration, recently, but over the last few years, we've seen a rise towards joint employer, which is looking at saying that a franchisor and a franchisee are jointly liable for any actions of a franchisee's employees. We're hopeful in the next 2 years, the first half of the Trump administration, to have a legislative solution to redefine franchising as it has been for decades, which is to say if there's not direct control, that franchisors and franchisees are completely independent and are not joint employers with each other. But that has been a huge investment for the International Franchising Association and for the officers that are a part of that organization, as I am. Probably 20% of my time over the last 18 months has been focused on educating and testifying and being active in the fight against the overreach on joint employer. We've seen that reach to Australia. Usually where bad legislation occurs in the U.S., it has outreaches into other parts of the world. So we're hoping we can get a solution here in the States, and so therefore we can help not have a negative impact of government overreach and completely unfounded rationale between linking a franchisor and a franchisee around employment decisions when those are clearly made by the franchisee. Franchisees don't want the franchisor involved in those decisions. They're independently owned and operated for a reason. They want to be their own bosses. And so that has been a huge impediment on the industry, and it has been somewhat difficult to make investments to grow, not knowing what was going to happen with joint employer. We're feeling much more optimistic about our alignment around policy with government officials and our ability to enact a solution over the next 12 to 24 months. I think the expos are really helpful for franchisees. A lot of times franchisees don't know what they might want to have as their next concept, if they're multi-concept, or what they might want to do as a first concept. So it gives them a chance to kind of, especially in a large expo show, sometimes try the food if they're thinking about food service, or if they were only thinking about food service, realize that there are other things like senior care and tutoring and child daycare and pet oriented concepts that they might not have thought about, but that they have a passion around. I think that's great. And I think for franchisors, it gives us an opportunity to showcase our brand and interact with those that might not otherwise have thought about our brand. So I think it's great for brand building. And, every now and then we'll wind up with a great candidate through an expo as well. For the franchisee, I think it's a very low investment way of an education as to all the things that possibly could be considered as a franchisee.